Hello, I'm Dr. Kaustubh Chakraborty and welcome to a new episode of Physiatry in 2 minutes. We shall be discussing today about the topic of osteoarthritis, what it is, what happens, and what can be done using this model of the knee joint, which is quite prone to osteoarthritis in the Indian scenario. If you see the joint, it has two bones that make up the joint, two cartilages, roughly the things that make up our nose and ear, which line the bones. The constituent is different from that which makes up our ear or nose. They provide smooth gliding. There is some fluid, there are ligaments, and there are some surrounding muscles in the joint. Now, osteoarthritis affects the entire joint. It's a result of the combination of both mechanical events, biological events that destabilize the normal wear and tear on one side and the regeneration on the other. This smooth balance is disturbed in the process of osteoarthritis. There are several risk factors for osteoarthritis, namely age, the female sex. In case of weight-bearing joints, obesity is one of the risk factors. A genetic predisposition is also there, as well as metabolic factors such as diabetes mellitus, hypothyroidism, hyperlipidemia. They have been associated with osteoarthritis. And as mentioned previously, it involves all the tissues. How? Number one, let's come to the articular cartilage. There is wear and tear of the articular cartilage, and sometimes it's asymmetric. That is, one part of the joint would be more affected than the other. Next comes the thin membrane that contains the fluid, the synovial fluid. It no longer remains thin. Previously, it was thought that osteoarthritis is a purely degenerative disease that is inevitable with age. Now we know there is a low-grade inflammation associated. This inflammation causes thickening of this membrane that contains the fluid, the synovial membrane. There are changes in the bones that surround the joint. The muscles that stabilize the joint undergo weakness, as do sometimes the ligaments that are there. They also become lax, and there is some instability of the joint, leading to a defective joint function. Patients will complain of pain, maybe some swelling, some problems in walking, or maybe in case of the knee, getting up from seated position, climbing stairs, and also on clinical examination, we might find that there is some fluid accumulated in the joint, there is instability and weakness of the muscles. From the physiatric perspective, we target each and every structure that are involved. There are now medications ranging from oral medications to injectables, including purified platelet-derived products that help in regeneration of this articular cartilage. Also, there are other injections such as steroids that have been there for a long time, and they do really work well in the short term. Hyaluronic acid is there that provides lubrication to the joint. Its use is sometimes controversial because not enough high quality studies are there, but in clinical experience we have seen that it does help to some extent. Also, we need the patient to go on a program of strengthening his or her muscles, losing weight, as well as sometimes bracing to support the ligaments and the joint as a whole. Shoe modifications may or may not be given depending on the case. There are papers which support it, some others that say it does not have really that much of an effect. As also, we must go in for a lifestyle modification so that the mechanical stresses on the joint diminish. For the knee joint, they include patient should avoid sitting on low seats, squatting, sitting cross-legged, must mandatorily use the Western style of lavatory, and plan his or her activities so that stair climbing is minimum. Combined with all these factors, both pharmacological, including the interventional things, non-pharmacological, including exercise, bracing, lifestyle changes, they constitute care of the joints, and in severe cases where the joint is unsalvageable, we can recommend surgery, for which we will refer the patient to our orthopedic colleagues. I hope that in a nutshell was educative enough for you. If you like the channel, click like, subscribe to it, and share with your friends. Bye for now, and see you in a fresh episode of Physiatry in 2 minutes.